Progress is often remembered through outcomes. A disease disappears, a generation survives, an outbreak fades. But the work behind those outcomes is usually invisible. Protection does not sustain itself. It must be maintained continuously against threats that never fully disappear. Maurice Hilleman understood this. Disease was not something humanity defeated once and for all. Viruses adapted, returned, and spread faster than public memory. Vaccines, to him, were not isolated breakthroughs, but systems of protection that had to be constantly developed, organized, and renewed. Hilleman devoted his life to building that system, not for recognition, but to make survival scalable, protecting millions of ordinary people from dangers they would ideally never have to see firsthand. Maurice Hilleman was born in rural Montana in 1919. The environment was harsh, isolated, and defined by labor. His family worked a farm during years when survival depended on consistency more than ambition. There was little glamour in the world he came from. Illness was common, medical access was limited. Children died from diseases that later generations would barely recognize as threats. This mattered. Hilleman's understanding of disease was never abstract. He did not enter science from a world protected from consequence. He grew up seeing vulnerability as ordinary life. Long before he became one of the most important scientists in modern medicine, he learned a simpler lesson. If a problem threatens everyone, solutions must work for ordinary people, not just the privileged few. In the early 20th century, infectious disease shaped daily existence with terrifying normality. Measles, mumps, rubella, whooping cough, influenza. Diseases moved through schools, towns, and families with seasonal regularity. Children survived until they didn't. Modern audiences often struggle to grasp the psychological environment of that era. Parents expected outbreaks. Communities feared summers because polio cases rose with the heat. Hospitals filled rapidly during influenza waves. Entire families could be altered within weeks. Hilleman entered microbiology during a time when medicine was beginning to understand that these disasters were not inevitable acts of nature, they were biological systems, and systems could potentially be interrupted. That possibility changed everything. During World War II, Hilleman worked on vaccines and infectious disease research connected to military survival. Armies learned quickly that disease could weaken nations as effectively as combat. For Hilleman, this period reinforced an important realization. Viruses evolve constantly. Protection could never remain static. Influenza became one of his central obsessions. Unlike diseases that remained relatively stable, flu viruses mutated rapidly, forcing scientists into an endless race against future outbreaks. This shaped the rest of his career. He did not believe medicine could simply win once. Public health required permanent vigilance. The enemy changed every season. One of Hilleman's greatest strengths was speed. He understood that waiting for certainty could cost millions of lives. In 1957, he identified signs that a dangerous new influenza strain emerging in China could become a global pandemic. Many officials moved slowly. Hilleman did not. He pushed aggressively for vaccine production before the virus fully spread across the world. That decision likely saved enormous numbers of lives. But the important detail is not simply that he was correct, it is how he thought. Hilleman viewed preparedness as a moral responsibility. The cost of overreacting was inconvenience. The cost of underreacting was catastrophe. This philosophy would define modern pandemic planning long after his lifetime. One of the most famous stories about Maurice Hilleman began at home. In 1963, his daughter became sick with mumps. Hilleman took samples from her throat and brought them directly to the laboratory. From that strain, he helped develop the vaccine that would later protect millions of children around the world. The story is remembered because it feels cinematic, personal, immediate. But beneath the anecdote was something deeper. Hilleman understood that medicine could not remain theoretical. Every outbreak was happening to real families in real time. Urgency mattered because delay had consequences measured in suffering. Science, for him, was never emotionally distant work. Over the course of his career, Maurice Hilleman contributed to more than 40 vaccines. Few individuals in history have had a greater direct impact on human survival. Vaccines for measles, mumps, rubella, hepatitis A, hepatitis B, meningitis, pneumonia. The scale becomes difficult to comprehend. Millions of lives saved is not poetic language in his case. It is statistical reality. But perhaps even more important than any single vaccine was the model he helped normalize: vaccination as public infrastructure. Not emergency reaction, but continuous protection woven into everyday life. An invisible shield maintained collectively. Success creates a strange paradox. The more effective prevention becomes, the less visible the danger appears. As vaccines reduced suffering, many people lost direct memory of the diseases themselves. Fear shifted away from outbreaks and toward the interventions designed to stop them. Hilleman often faced skepticism, institutional conflict, and political resistance. Public health was never purely scientific. It involved trust, communication, logistics, economics, and culture. This frustrated him deeply because he understood something difficult about prevention. When prevention works, people begin to believe it was never necessary. The absence of catastrophe rarely feels dramatic, but absence can be the greatest achievement of all. Unlike many famous scientific figures, Maurice Hilleman never became a household icon on the level of an Einstein or an Edison. His work operated mostly in the background, yet nearly every vaccinated child carried evidence of his influence. This reveals something important about civilization itself. Some of the most transformative people are not remembered through monuments or speeches, but through systems that function so reliably they become invisible. Clean water, electricity, sewage systems, vaccination programs. Their success hides the chaos they prevent. Hilleman helped build one of the largest protective systems in human history, not through spectacle, but through repetition, precision, and relentless maintenance. We often describe freedom positively. Freedom to move, speak, create, choose. But there is another kind of freedom. Freedom from constant fear. Freedom from epidemics shaping everyday life. Freedom from preventable disease devastating families and communities. Maurice Hilleman spent his life expanding that form of freedom. But protection is never permanent. Viruses evolve. Public trust shifts. New threats emerge. The systems guarding human life only survive if societies continue maintaining them long after the immediate danger has faded. That was Hilleman's lasting lesson. The greatest victories against chaos are not final triumphs. but responsibilities renewed again and again. Some stories fade, others wait to be heard,